Hey guys,
this is Jen
Tina.
Danny.
and Kristy, and we're going to be presenting on Parkinson's disease.
Parkinson's disease is a chronic progressive neurodegenerative disorder. 1 million Americans are believed to be living with Parkinson's disease. Incidence of Parkinson's increases with age, but 4% of people have early onset Parkinson's, which means it develops before the age of 50, and it is more common in men than women. The exact cause of Parkinson's disease is unknown. 15% of patients with Parkinson's have a positive family history for the disease that may be caused by mutations in specific genes. In other people, risk for Parkinson's disease may be increased by well water, pesticides, herbicides, industrial chemicals, and wood pulp mills. Some drugs can also cause Parkinson's disease, like amphetamines and methamphetamines. A deficit in dopamine exists in Parkinson's disease. This deficit creates an imbalance between dopamine and the excitatory neurotransmitter acetylcholine. In Parkinson's, neurons in the substantia nigra that supply dopamine degenerate. When a deficit of dopamine occurs, excitatory effects of acetylcholine go unopposed and disturbed movements, such as tremor and rigidity, result. The neurotransmitter dopamine is essential for normal functioning of the motor system, including control of posture, support, and voluntary motion. Manifestations of Parkinson's disease do not occur until 80% of the neurons in the substantia nigra are lost.
So, like Tina said, the signs and symptoms don't really occur until 80% of the neurons are already damaged. The onset of Parkinson's is gradual and insidious, with an ongoing progression. The clinical manifestations are tremors, rigidity, akinesia, and postural instability, and you can remember this by the mnemonic TRAP. Tremor is often the first sign, and oftentimes the patient is the only one who notices it at first. The hand tremor in Parkinson's is described as pill rolling because the thumb and forefinger appear to move in a rotary fashion as if rolling a pill, coin, or small object. This tremor can also involve the diaphragm, tongue, lips, and jaw. Rigidity is the second symptom commonly seen in Parkinson's. This is sustained muscle contraction that causes the rigidity and consequently elicits complaints of muscle soreness, feeling tired and achy, or pain in the head, upper body, spine, or legs. Slowness of movement is another consequence of this rigidity because it inhibits the alternating contraction and relaxation in opposing muscle groups. The third symptom is akinesia. This is the absence or loss of control of voluntary muscle movements. In Parkinson's, you often see bradykinesia, which is the slowness of movement, and it's particularly evident in the loss of automatic movements. In someone without Parkinson's, automatic movements are involuntary and occur subconsciously, like blinking your eyelids, swinging your arms while walking, swallowing, and using facial and hand movements for expression. However, the person with Parkinson's doesn't execute these movements and lacks spontaneous activity, so you might see a masked facial expression, like a deadpan expression, drooling, and a shuffling gait. The last symptom is postural instability. This is common, and patients may complain of being unable to stop themselves from going forward or backward. Assessment of postural instability includes the pull test, which you'll see in a later slide. So let's go over the mnemonic TRAP one more time with this picture. The T is for tremors, which you can see by this man's hands. His movement is a pill rolling movement. The R is for rigidity, and here you can see it by his joints and his back. The A is for akinesia, which is the absence of normal movement. So you see that here. His left arm doesn't swing when he walks. He's got some drooling and a deadpan facial expression. And the P is for postural instability, which you can tell he's hunched over and he's got a shuffling gait. Some of the other signs and symptoms you might see with someone with Parkinson's have to do with the result of their medications. So they could have some insomnia, mood swings, hallucinations even, and depending on the progression of the disease, they can also have some dementia and cognitive impairment. So you kind of need to assess your patient and see where they're at cognitively. The person with Parkinson's may also have quite a bit of pain. The rigidity causes them a lot of muscle soreness, so a pain assessment would be very important for your patient with Parkinson's. Overall, you'll see management-wise, it has a lot to do with managing the symptoms. So there's definitely some drug therapy. You'll need to help them with just maintaining independence, whether it be eating or daily needs like going to the bathroom, combing their hair, and exercise and nutrition are also very important for the patient with Parkinson's disease. So you kind of just need to do an assessment to see where your patient is at. Overall, this patient in the picture is experiencing signs and symptoms such as tremors in the head and hands, rigidity and akinesia in the muscles, and postural instability by his stooped posture. Because no specific diagnostic test exists for Parkinson's, diagnosis is more so based on the patient's history and clinical manifestations. The clinical diagnosis requires the presence of TRAP. The confirmation of Parkinson's is a positive response to anti-Parkinsonian meds. MRI and CT can help the diagnosis, but it more so just is a way to see if something like a stroke or a brain tumor is the cause of the same kind of symptoms. So what you need to remember is that the diagnosis relies on the patient's symptoms and their response to Parkinson's medications.
Levodopa with carbidopa is a primary treatment for symptomatic patients. Levodopa is a chemical precursor of dopamine and can cross the blood-brain barrier. It is converted to dopamine in the basal ganglia. Cinnamon is the preferred drug because it also contains carbidopa, which is an agent that inhibits breakdown of levodopa before it reaches the brain. The net result of the combination of levodopa and carbidopa is that more levodopa reaches the brain and therefore less drug is needed and more dopamine is available. And on page 1390, under the drug alert, it also says to monitor for signs of dyskinesia, which is the involuntary jerky movements, and that effects may be delayed for several weeks or months. Bromocriptine is a dopamine receptor agonist and is often used in conjunction with levodopa. And just like levodopa, it also relieves symptoms like rigidity and tremors. Bromocriptine can cause GI upset, so make sure to administer with food or milk. It can also cause drowsiness and orthostatic hypotension, so make sure to educate your patient to change position slowly. And notify the healthcare provider of any signs of MI. Amantadine is an antiviral agent and is also a weak antagonist of NMDA glutamate. Amantadine increases dopamine release and blocks its reuptake. It only provides mild relief and is seldom used in early stages of Parkinson's. Make sure to not give the last dose near bedtime to avoid insomnia, and inform your patient that this med can take up to 2 weeks to get the full effect. Also, caution your patient to change positions slowly to prevent orthostatic hypotension. And if you're discontinuing this med, make sure to do so gradually to prevent the worsening of dyskinesia.
Anticholinergic drug Cogentin is also used in the treatment of Parkinson's disease. This drug can be used for the treatment of resting tremors. However, they are not particularly effective for bradykinesia, rigidity, gait disturbances, or other features of advanced Parkinson's disease. Therefore, Cogentin is usually reserved for the treatment of tremors. A side effect of this drug can be constipation. A nurse implication will be to assess bowel movements and sounds, and also to administer this drug with food or immediately after meals to avoid GI upset.
Entacapone blocks the enzyme COMT, which breaks down levodopa in the peripheral circulation and thus prolongs the effect of cinnamon. This drug reduces the signs and symptoms of Parkinson's disease. This drug is only used as an adjunct to levodopa and can exacerbate adverse effects of levodopa, such as dyskinesia and orthostatic hypotension. Nausea may occur while on this drug, so maintain adequate hydration and monitor for weight loss.
For the surgical therapies that can be used, the most common treatment is DBS, deep brain stimulation. It places an electrode in the thalamus and connects it to the generator via a wire that is placed in the upper chest like a pacemaker. It sends currents to your brain, which will help to alleviate some of the common symptoms of Parkinson's, such as tremors and akinesia. Other types of treatments involve ablation, which destroys infected area of the brain to stop tissue from producing abnormal chemical or electrical impulses, and transplantation, which is a fetal neural tissue that is placed into the basal ganglia to provide dopamine-producing cells. In regards to nutritional therapy, malnutrition and constipation can be serious consequences of inadequate nutrition, so make sure that the patient has an adequate amount of fiber and fruit to avoid constipation. Also, make sure for patients who have dysphagia or bradykinesia that they have foods that can be easily chewed or swallowed. And if they're taking levodopa, make sure to limit the protein intake and vitamin B6 because it can impair the effect of levodopa.
Parkinson's disease is a progressive neurodegenerative disorder characterized with motor and non-motor complications that might differ from person to person. Motor symptoms of this disease include tremors that are usually first noticed in the hands when the person is at rest, but might gradually involve other parts of the body like the lips, jaw, or legs. Also, a person might experience bradykinesia, which refers to an overall reduction of spontaneous movements, difficulty in initiating movements, and slowness in physical actions. A person experiencing bradykinesia can have difficulties performing everyday functions. Rigidity is another major motor complication of Parkinson's. It can contribute to a decreased range of motion and lead to pain in the muscles or joints affected. Postural instability is also another symptom of Parkinson's disease. It will impair a person's balance and make him more susceptible to falls. Non-motor complications include weakness, fatigue, hallucinations, and in the advanced stages, it can also cause cognitive changes and lead to dementia. In addition, as the disease progresses, swallowing can become severely compromised, putting the patient at risk for aspiration. And in this disease, aspiration pneumonia is the leading cause of death.
Some possible nursing diagnoses for Parkinson's disease include impaired physical mobility, imbalanced nutrition less than body requirements, impaired swallowing, impaired verbal communication, risk for falls, impaired walking, acute pain, impaired comfort, and as the disease progresses, risk for stress overload and caregiver role strain.
Here are some of the possible nursing interventions for a patient with Parkinson's disease. Depending on the progression of symptoms, the patient may need help setting up their food tray and even eating with special utensils because of their tremors. Asking the patient will help the nurse to know how debilitating the symptoms really are. Even though some people may seem independent, it's always a good idea to ask the patient how they eat. Another one is aspiration precautions. You should set up suction just in case the patient has dysphagia or difficulty swallowing, and make sure that you teach the patient to sit up while eating and maintain a Fowler's position for an hour after eating to prevent aspiration. A person with Parkinson's should also have a well-balanced diet. It might be hard for them to eat just 3 meals a day, so several small, high-calorie meals might be a better option. But a lot of this you can get from a registered dietitian, so consulting with an RD would be a good idea. And watch out for protein intake. High protein with levodopa is actually bad for the medication. So it said that you can give the patient protein, but limit it to 1 meal a day. So give them high protein maybe just at dinner time instead of throughout the day. Another good intervention is daily weights and INOs. Some people with Parkinson's start to lose a lot of weight, so monitoring that will show if they have any imbalanced nutrition. And that goes into BMP panels as well. You can see if the patient has an electrolyte imbalance, and correcting that will also help the patient's cognitive function, healing time, and promote weight gain. It's also important to assess lung and bowel sounds. Parkinson's puts patients at risk for aspirating and decreased chest expansion, so that's why you should assess their lung sounds. And constipation is a common side effect of medication. So decreased bowel sounds and rapid treatment with stool softeners can improve the patient's comfort and prevent obstruction. The patient should also have easy to remove and put on clothing because they have tremors and decreased muscle movements. So you want them to be able to have as much independence as possible, like going to the bathroom. So you want them to be able to, take off their clothes pretty easily. And avoiding shoelaces is also a good idea because of their tremors and decreased dexterity. You want to promote physical exercise because they get really rigid and they have that stooped posture. So maybe consult with PT and OT. You should also put people with Parkinson's on high fall risk precautions. So bed in low position, side rails up, personal items within reach. All the regular fall precautions should definitely be utilized for a patient with Parkinson's. The person with Parkinson's also needs to be aware of bathroom safety. So maybe find a raised toilet seat. That way it's easier for them to get on and off the toilet. Medications also cause insomnia for people with Parkinson's. So make sure you maintain a calming and relaxing environment for that person. And make sure to only give those meds during the daytime and not before bedtime. Mental changes like dementia occur with the progression of Parkinson's. So make sure you are doing cognitive functioning assessments and orienting your patient who has Parkinson's. They also could have depression and anxiety just because of all the symptoms, and it makes them lose their independence and they become really dependent on their family, and that can be really hard for some people. So make sure that you're using therapeutic communication with your patient.